Alright, so this video is about the causes and the prevalence of schizophrenia. I know I got into the causes in the last video, but I'd like to reiterate some things and add some more information. So, like I said in the last video, genetics seems to play a big factor in schizophrenia. It can sometimes run in families, and I'll include a graph that shows that's been a big study, and I'll include that graph in my slide next to my video so you can see, depending on which family member you are, your chance of schizophrenia, what your chance of getting schizophrenia would be, and the prevalence of it. So genetics is sometimes a factor, but just because somebody in your family has it does not mean that other people in the family will have it as well. With identical twins, that is the largest chance. If your twin has it, there's going to be a very high chance of the other twin having schizophrenia as well. Environmental factors. The environment does play a role in schizophrenia. Living in poverty, stressful surroundings, and having exposure to viruses as well as nutritional problems while in the womb. Those are factors that can cause schizophrenia. The last thing is disruptions in brain structures, brain function, and brain chemistry. But those are also results of genetic and environmental factors as well, which might cause schizophrenia. And I know I talked about some of those things in the last video, but those are very important, so I thought I would reiterate them. Let's go more into the causes. So it's not known exactly what causes it, but researchers do think that it's a combination of genetics, brain chemistry, and environment that contributes to the development of this disorder, like I covered. But problems with certain naturally occurring brain chemicals, like neurotransmitters, the neurotransmitters are dopamine and glutamine. Those might contribute to schizophrenia. There was neuroimaging studies that showed differences in the brain structure and central nervous system of people that have schizophrenia. So again, while researchers aren't positive about the significance of these changes, they indicate that schizophrenia is a brain disease. So that is important to know. Let's go into some of the risk factors here. Alright, so having a family history of schizophrenia is certainly a risk factor. Having increased immune system activation, such things like inflammation or autoimmune diseases, that's a risk factor. Having, this one's kind of interesting, it really is, having the older age of the father, pregnancy and birth complications, some of them, not all of them, malnutrition or exposure to toxins or viruses that may impact the brain development. Taking mind-altering psychoactive or psychotropic drugs, especially during the teen years and young adulthood. So those are some of the causes of schizophrenia. So let's talk about how we can prevent schizophrenia. So a lot of this information will pertain especially to teens and young adults. So how can you prevent it? So one way is don't use street drugs and don't use alcohol too much. So street drugs, they have chemicals in them that can be harmful to a teenager's brain or young adult's brain, as well as significant alcohol consumption. It has been shown to cause brain damage, and it could potentially increase the risks of psychosis and likely schizophrenia as well. There's a lot of research that indicates that drugs and alcohol are especially risky for people that have a mental illness history in their family. So if you have a mental illness history in your family, drugs and alcohol can be especially negative. It's also notable that alcohol abuse is a stronger predictor of psychotic symptoms than regular cannabis abuse. So that's interesting. It's by a factor of 4. All right, another way to prevent schizophrenia in young adults and teenagers is making an ongoing effort to develop your social skills as much as you can and maintain at least a few close friendships that you can discuss issues with freely. Now this seems kind of simple, but it is important. So having tendencies towards shyness, it's especially important for those young adults to make an extra effort to learn about these social skills, to talk to other kids, other teenagers, other young adults, some people that they can confide with, that they feel comfortable talking to, and they can talk about personal issues. So these social skills are important. The next way kind of piggybacks off the last reason, so avoiding social isolation. Don't spend too much time by yourself. That's what this one could be boiled down to. Try to get out, enjoy time with other people, enjoy time with your friends. And at the college level, living with a roommate, it can help with this as well. And I have read that kind of different, but kind of on the same topic, that the suicide rate can significantly increase for people living by themselves, especially for young males. So that's kind of on the same page with avoiding social isolation to prevent schizophrenia. Another way is to make an ongoing effort to maintain friendships with adults who you trust and respect and who are compassionate, helpful with any challenges you face. Not just avoiding social isolation and not just making friendships with people your own age, but also as a young adult, making friends with older adults, people you can trust, people who have that life experience, who you can talk to, seems to be another way to help and prevent schizophrenia. Also, trying to make an extra effort to learn positive perspectives on the world and situations you encounter. So having that positive mindset, going the extra mile, trying to be positive, have a positive perspective on the world, making sure that you understand that everybody goes through setbacks or problems, and that you're going to encounter these things. But if you look at these as opportunities for growth and merely as part of anybody's normal life, you're going to overcome these problems and they're not going to affect you as much. Another way would be to make an extra effort. Again, a lot of this has to do with effort. Make an extra effort to learn how to deal with stress and anxiety or fear, and get regular exercise. So exercising regularly will help prevent schizophrenia. When you do have that stress, depression, sadness, anxiety, discuss these issues with your friends, your family. Read books. There's a lot of books here. Exercise the State of Mind. Exercise Stimulates the Formulation of New Brain Cells. These are great books to read. When Panic Attacks, The New Anxiety Therapy That Could Change Your Life by Dr. David Burns. Feeling Good and the Feeling Good Handbook by Dr. David Burns. These are some recommended books for people that are feeling these anxiety to read, or some of these are articles as well. So 30 minutes of vigorous exercise 3 to 5 times a week will also help. And the last thing to try to help and prevent schizophrenia is seeking help from a qualified psychologist and psychiatrist if you have problems coping. So this is the last thing we have listed here. Find somebody who is qualified, and you can talk to them about the difficulty you have dealing with stress, anxiety, worry, and sadness, or depression. If you're having odd thoughts and you don't understand how to cope with them, talking to a qualified professional can help. Especially if you have that family history of mental illness, that will help.